Precisely what is PrEP, and so why should I care? Pre-exposure prophylaxis is the use of medications to prevent the spread of disease in people who have not yet been exposed to a disease-causing agent, usually a virus. The term typically refers to the use of antiviral drugs as a strategy for the prevention of HIV/AIDS. PrEP is one of a number of HIV prevention strategies for people who are HIV negative but who have a higher risk of acquiring HIV, including sexually active adults at increased risk of contracting HIV, people who engage in intravenous drug use, and serodiscordant sexually active couples when used as directed. PrEP has been shown to be highly effective, reducing the risk of acquiring HIV by up to 99%. As of 2019, the World Health Organization recommends 2 drug combinations for the use as PrEP for HIV/AIDS, the combination of tenofovir disoproxil and emtricitabine, or the combination of tenofovir disoproxil and lamivudine. In October 2019, the U.S. Food and Drug Administration approved the combination of emtricitabine and tenofovir alafenamide to be used as PrEP in addition to Truvada, which provides similar levels of protection. In December 2021, the FDA approved cabogravir, which is an injectable form of PrEP. Regulators believe it will improve medication adherence because it only has to be taken once every 2 months, and will also widen adoption as it eliminates the need to hide pills or pharmacy visits for discretion. Medical uses. In the United States, federal guidelines recommend the use of pre-exposure prophylaxis for HIV-negative adults with the following characteristics: sexually active in the last 6 months and not in a sexually monogamous relationship with a recently tested HIV-negative partner, and who is a man who has sex with men and who has had anal sex with another man in the past 6 months without a condom, or has had a sexually transmitted infection in the past 6 months. Or is a sexually active adult, and who is a man who has sex with both men and women, or has sex with partners at increased risk of having HIV without consistent condom use, or anyone who has injected illicit drugs in the past 6 months, shared recreational drug injection equipment with other drug users in the past 6 months, or who has been in treatment for intravenous drug use in the past 6 months. In the United Kingdom, the BHIVA/BSHH guidelines on the use of HIV pre-exposure prophylaxis 2018 recommend on-demand or daily oral tenofovir and emtricitabine for HIV-negative MSM who are at elevated risk of HIV acquisition through unprotected anal sex in the previous 6 months and ongoing unprotected anal sex. On-demand or daily oral TDF-TC for HIV-negative MSM having unprotected anal sex with partners who are HIV positive, unless the partner has been on ART for at least 6 months and their plasma viral load is lesser than 200 copies ml. Tenofovir alone should not be offered to MSM. Daily oral TDF-TC for HIV-negative heterosexual men and women having unprotected sex with partners who are HIV positive, unless the partner has been on ART for at least 6 months and their plasma viral load is lesser than 200 copies ml. Daily oral TDF-TC for heterosexual men and women on a case-by-case basis with current factors that may put them at increased risk of HIV acquisition. TDF alone can be offered to heterosexual men and women where FTC is contraindicated. PrEP is not recommended for people who inject drugs where needle exchange and opiate substitution programs are available and accessed by the individual. PrEP with daily oral TDF-TC for HIV-negative trans women who are at risk of HIV acquisition through unprotected anal sex in the previous 6 months and ongoing unprotected sex. Daily oral TDF-TC for HIV-negative trans women and trans men who have unprotected sex with partners who are HIV positive, unless the partner has been on ART for at least 6 months and their plasma viral load is lesser than 200 copies ml. Other government health agencies from around the world have devised their own national guidelines for how to use PrEP to prevent HIV infection in those at high risk, including Botswana, Canada, Kenya, Lesotho, South Africa, Uganda, Zambia, and Zimbabwe. Often, laboratory testing is required before starting PrEP, including a test for HIV. Once PrEP is initiated, individuals are asked to see their healthcare provider at least every 3 3 to 6 months. During those visits, providers may want to repeat testing for HIV, test for other sexually transmitted infections, monitor kidney function, or test for pregnancy. Individuals must test negative for HIV prior to PrEP initiation because persons infected with HIV taking PrEP medication are at risk for becoming resistant to emtricitabine. Consequently, people with HIV infection and resistance to emtricitabine will have less options for selecting HIV treatment medications. PrEP has been shown to be effective at reducing the risk of acquiring HIV in individuals at increased risk. However, PrEP is not 100% effective at preventing HIV, even in people who take the medication as prescribed. There have been several reported cases of people who acquired HIV despite taking PrEP. People taking PrEP may use combination prevention strategies along with PrEP, like condoms. If someone on PrEP acquires HIV, they may experience the signs and symptoms of HIV/AIDS,